Hi Warm Springs, this is Dane, physical therapist with the Warm Springs Holistic Health Clinic, and today we are going to talk about the IT band. Now, you've probably heard about the IT band in the news. A lot of athletes struggle with IT band syndrome. It's typically an overuse syndrome that comes from pushing too hard too quickly and the body's just not ready for it, specifically in this case, the IT band. So let's talk a little bit about what the IT band is. This is a side view of the right leg. So you can see it stretches all the way from the hip up here down to the knee. Up here at the hip, we have two muscles that insert onto it. We've got the glute max back here. We have the TFL up front, your tensor fasciae lata. And yeah, both of these insert onto the IT band, pull on it, and comes down here. There are some research shows over 20 insertions around the knee, so it can be pretty diffuse around there. But some more research on top of that has shown that to deform this tissue 1%, it would take over 2,000 pounds of force. So if we want to affect this tissue here, we actually want to look a little higher up to these two muscles that insert onto it. So let's talk about lengthening those muscles. The very first that we're going to talk about is just using a foam roller to address that. Now, you can definitely foam roll the IT band, and if you go to the gym, you'll probably see some people rolling out their IT band and wincing in pain. You can desensitize that tissue by rolling on it, but once again, we can sometimes be a little bit more effective by going up to that TFL and then rolling back and rolling out the glute max as well. This takes a little finessing to get used to rolling on the foam roller, but you get the hang of it pretty quick. If you don't have a foam roller, you can also use a ball, a tennis ball, lacrosse ball, golf ball, even a dog toy, really anything that's small and can roll. Put it up against the wall or the floor, and then just roll around, do a little self-massage to those two muscles there. And then also strengthening is really important. So like in our last two videos, talking about glute bridges, hip thrusters, those glute max specific exercises, but then also doing some lateral steps, working these exact muscles that are on the outside of the hip to strengthen up this area, make yourself a little bit more resilient so that hopefully you don't have to deal with IT band pain in the future. So hopefully this was helpful, and we'll talk to you guys next time.